Hi, everybody. I'm Dr. Sanda Moldovan, periodontist and nutritionist. Welcome to the Holistic Dentistry Podcast, the show that gives you the tips and tools to detoxify your mouth for a healthier body as we explore together the root cause of disease. Remember, you're not healthy until your mouth is healthy, so take care of it in the most natural way. Hi, everyone. Welcome to the Holistic Dentistry Show. And today I have a very special guest, and I'm really excited to talk about the subject because so many people don't know what myofunctional therapy really is and how it could really, truly change your life and your sleep. And with me, I have Joy Mueller. She is a dental hygienist, author, and formerly an associate professor at Indiana University, who has worked as a myofunctional therapist for many years and currently has a private practice in Pacific Palisades, California. Joy is founding lecturer with the Academy of Orofacial Myofunctional Therapy, IOMT, and a founding board member of the AAMS. She has taught postgraduate courses in myofunctional therapy at universities and hospitals worldwide. Joy wrote a chapter in sleep medicine clinics, a chapter in sleep disorders and pediatric dentistry, and a chapter in management of obstructive sleep apnea, textbook for oral surgeons in 2021, and a children's book on tongue position, as well as many published studies and other chapters in textbook and a book that's soon going to be coming out. Joy has lectured worldwide, was the first myofunctional therapist to be on staff at the Pankey Institute. She currently teaches at the Palo Alto School of Sleep Medicine and taught for 7 years with UCLA Dental Sleep Postgraduate Program and the Pedo Ortho Residency. Joy received a Lifetime Achievement Award from the AAPMD and a Louis Pasteur Award from the Association of Applied Myofunctional Sciences in Rome. Welcome to the show, Joy. So excited to have you.
So excited to be here. Spreading the word.
Yeah, definitely. So let's start with what is myofunctional therapy?
Okay. Well, nobody knows about it, but I'll explain. It's myo is muscle. Function is function of the oral muscles. We deal with 58 muscles of the head and neck and the function of those muscles. And we work on breathing, chewing, and swallowing correctly, and eliminating habits. So many people have habits that they're not even aware of, like playing with their hair or leaning or biting their cuticles or so many things. And we figure out why they're doing it and then work on that. It's all about the why.
So who are your clients? Is it children, adults, or both?
Young babies all the way to my oldest patient was in his 90s.
Oh, wow. Impressive.
He didn't like wearing a CPAP, so we helped him.
So myofunctional therapy is really working with these 50 plus muscles of the face and kind of help them be like working synonymously together?
Yeah, well, it's restoring normal function. What's happened is people have changed. And there's a lot of research coming out showing that breastfeeding done correctly long enough and eating more solid foods rather than baby foods, like before 1930, there was only people food. There wasn't baby food because we didn't have blenders. So
that's right. So
would just reach over and grab something off mom's plate and chew on it and develop their jaws. But people now, they eat baby food and then they transition to pouches and then they transition to macaroni and cheese and pasta and sauce smoothies and chicken nuggets, and they don't chew.
Yes, absolutely. But let's go back to the breastfeeding, because this is so important. And a lot of moms actually don't know that breastfeeding actually helps to form the jaws.
Yeah.
So that's why maybe we have so many kids nowadays doing orthodontics because they weren't breastfed long enough. So what is the norm with breastfeeding, and how long do we have to do it in order for the arches to develop properly?
That's a great question. About 15 years ago, I worked in an office with an environmental medicine specialist, and she introduced me to Shelley Marmette, who was the lady who pioneered and conceptualized the whole field of lactation consulting. She said that, because I asked that same question, when should
Yes.
you stop breastfeeding? Well, the reality is you need to let the baby take the lead. Some
I see.
babies at 9 months, they don't ever want to look at another breast. And some babies need to go on to 3 years or even longer if they have allergies, because the breast milk will prevent allergies. Even if you just breastfeed once a day, it helps. But
Mm,
it's like mothers knew that for millions of years, and even as the child got older, they still would breastfeed a little bit, and they knew that breast milk helped the immunity.
absolutely.
So,
And a lot of moms might say, oh, you know what? I can get a bottle that basically mimics the breast, and it's basically the same thing. Are we really using the same muscles when we
no,
do
you
the
can't
bottle?
fool Mother Nature, because when you're breastfeeding, the tongue is trying to strip the nipple and milk the nipple. When you're bottle feeding, your tongue is resting down and you're moving your jaws to get the milk out.
I
There
see.
isn't a nipple made that will do what a mother's breast will.
Absolutely. I agree with you. So,
It's
so for
hard
those,
work. It's hard work. But
mhm.
once the baby gets it and learns how to do it, and the mother learns, the health the health parameters are so much different
Mhm.
for that person.
If the baby's not breastfed, what do you see in terms of the formation of the jaws? Do you like what are the
Well,
signs?
I'll show you on my little rubber mouth. This is the palate, and when the breast is in here and the tongue is pushing, this area widens and grows and forms forward and wider. And when it doesn't form, when it's just a rubber nipple, this is what happens. The
That's right.
palate
You get
gets
crowding.
high and narrow. There's not enough room for the teeth, and the the muscles in the back of the throat collapse.
Mhm.
We call that the Malampati score. The airway gets smaller, and then the child develops a mouth breathing habit. And when they breathe through their mouth, the mandible slips back, and
Mhm.
then they become a habitual mouth breather. They're not getting enough oxygen, and so they develop a condition called ADHD, where
How
they
interesting. A lot of people wouldn't even associate breastfeeding to ADHD. But clearly there's a connection there in the way our jaws get shaped from breastfeeding.
yeah, I'll show you. I have a good diagram here. I think it's really interesting. So,
Mhm.
like, these are your teeth. This is the house for the tongue. This is where your tongue is supposed to rest. But if you're bottle fed or suck your thumb or do the mouth breathing, this is what happens. And the roof of your mouth is the floor of your nose. So as that collapses and gets narrower, people become mouth breathing. And so
Yes.
what we do as myofunctional therapists is get the tongue to go up and help that arch to widen.
So once you get somebody, let's see, that has this narrow palate or roof of the mouth, through myofunctional therapy, you can change that shape again, correct?
It's form and function. You swallow 500 to 1,000 times a day with 4 pounds of pressure, 55 grams per centimeter. So if your tongue is going up over time, it's going to help to create a better form.
Up to what age can you actually reshape these, facial
Even
structures?
as an adult, I can show you pictures before and after of how patients have widened. It's a lot harder. And certainly I'd like the help of orthodontists or functional dentists that can help, but that doesn't always happen. Sometimes we're on our own. People just want nature to do it. They've already worn braces 2 or 3 times and don't want to do it again.
So what's the ideal age for a patient to get to you to kind of help with this
Well,
reforming of the
I just saw a 4-year-old that was diagnosed with sleep apnea today on my schedule. Little boy, Zachary, and he's been working with me a while, and he's now sleeping.
Amazing.
Now,
That's
his
great. So
face
that's
has
around
changed.
around 4 and 6 years of age. That would be
Yeah, so 3. I like to see them at 3.
okay. And they follow instructions properly to where.
Oh, they have fun. There's chewing fun things and all kinds of prizes we have, and buttons and strings and pulleys, and it's
Okay, great.
love doing it.
Yeah. So for those of you are there that are listening, thinking, "Oh my God, this might be something really scary," it's not. For kids, it can be really fun, something they could look forward to, and also improve their sleep, which is great.
They're
So,
chewing too, so many
yeah.
kids have not mastered the art of chewing. And so we have little devices that we use, chewing devices and things that are fun to chew on. And that
So
helps
this,
the building.
how does one not know how to chew?
Well, if they've been given baby food and if their tongue is not functioning, the tongue is actually an organ. It's a respiratory organ. Everybody thinks the tongue is muscle, or it's really an organ. It has 16 muscles in it, and it works with the diaphragm. The diaphragm is this muscle that goes around your waist, like, and attaches to your low back. And when you breathe in and out, it expands and contracts. And if the back of the tongue is functioning, it works with the diaphragm to fill the lungs with air all the way down to the base of the lungs. So it's very important to have your tongue in the right place all the time and functioning correctly.
That's really fascinating, Joy.
It helps chewing because the muscles can gather the food and put the food in between the molars that grind the teeth.
Fascinating. I always saw that as a tongue of muscle. So you're teaching me definitely something new, that it's attached to the diaphragm. So people that are not breathing with their diaphragm, are they impacted?
Oh yeah, they can't breathe. They can't focus. They're groggy and tired. They'll wake up in the middle of the night gasping for air. And they choke because their tongue is falling into the airway. People don't realize that the noise of snoring is the back of the tongue, the genioglossus, which is falling into the airway.
Yeah.
So what we do is make that strong, the back of the tongue strong and going up.
So with myofunctional therapy, you can help strengthen the tongue?
Yeah.
So it doesn't fall in the back of the throat?
Right.
Fascinating. Actually, I was looking at a study just before we got on this, and you can improve sleep apnea with myofunctional therapy up to 50% in 50% of the cases, which is quite
in
high.
Adults and 62% in children.
Yeah, amazing. They're probably more receptive and to therapy.
I think every dentist should have access to a myofunctional therapist because it goes along with gum disease. If you're mouth breathing, the bacteria multiply.
Absolutely.
And if you're breathing through your nose and you develop a lip seal, that's one of our goals is lip seal, then it all kind of works together to help. And also if you're a tongue thruster, if your tongue is coming forward, when you swallow, it weakens the ligaments around the teeth.
Yeah. And mouth breathing is a real problem. Actually, I used to be a mouth breather as a child. So I had some myofunctional therapy back in Romania to strengthen because I had this lip incompetence. So I remember I had this little like button with an elastic to work my lip muscles. Is that still being done today?
It's interesting that you said in Romania, is because
Yes.
other countries are on this. In Brazil,
Yes.
they do myofunctional therapy in schools.
Amazing. I think we should be doing the same thing in schools because that's where we have their attention the
Yeah,
most.
yeah.
Definitely. So
Actually, there are some schools that are starting it, some holistic schools in, I think, Manhattan Beach. They're going to start doing that.
yeah, fantastic. Because as more and more moms are now breastfeeding, we have more and more problems in children. Is that what you're seeing?
Yeah, yeah, yeah. Because we have now epigenetics where, so say you weren't breastfed long enough and your mother wasn't, but your grandmother was. And so now we have 3 or 4 generations where things are going awry. And myofunctional therapy becomes life enhancing.
Yes, absolutely. I want to go back to the mouth breathing because I have a lot of patients that are saying, oh, you know what? I am just taping my mouth. So is that enough for somebody with mouth breathing or it's still
Well,
something that
it helps at night when you tape, but during the day, you have to behavior modify yourself to do it correctly.
how long does it take to do this behavioral modification for mouth breathers?
Well, I use different techniques. Of course, I'm trained by the Buteyko method, but other things I do as well. Well, it usually takes about 2 months, 3 months. You can do it. Yeah.
Okay, so it's a relatively short treatment. So for those of you out there listening and they're mouth breathers, look up Joy in Pacific Palisades and they should come see you for that because that's definitely going to be worth it.
Yeah. But you need to do everything, not just the breathing, the chewing and swallowing too. And we eliminate habits and we help to develop facial symmetry of them with the muscles. But breathing
Yes.
is always done first.
Okay, so you have a certain
First part of
sequence.
it. Yeah.
Yeah.
Because if you're not breathing, where's your tongue? It's down.
Oh, that's right.
Well,
So
the
it's not
palate
used
is
for
closed.
chewing.
Yeah, and chewing.
Mhm. Mhm.
Too many people now have smoothies and just
Not enough fiber in our diets. Yeah.
you have
Yeah,
to
and I'm a big proponent of this. Like people need to have fiber. They need to eat a whole fruit, a whole vegetable. Absolutely.
and if you're not chewing, the muscles here, the masseter muscles collapse. And then what happens is the gland called the parotid gland back here, when you chew, you're milking that gland. And that
Mhm.
gland secretes enzymes that help you pre-digest your food in your mouth.
Mm.
So if you like smoothies, what I tell people to do is right before you turn it off, throw some nuts in there. So you have to chew your smoothie. That way you're getting the enzymes that help to break your food down. So many people have gut problems
Yes.
not chewing.
I like that. Chew your smoothie. Definitely put something crunchy with fiber there. So don't fully blend the smoothie also to give you something to chew on.
Yeah. Of course, your teeth have to be aligned pretty good to chew properly.
Yeah. And what about the people who don't have back molars and they say, "Oh, you know what? I'm missing teeth. Who cares? It's fine. I don't need them." What
Yeah.
would you say to them?
You can use the alveolar ridge to chew. A lot of people, like in other countries, that have lost all their teeth. I knew a fellow that used to take his dentures out to chew because he could eat a steak easier with the bone.
With the bone than with the denture. Yeah. So true. Yeah. But let's go back to how did you get interested in myofunctional therapy? How did you find out about it?
Well, I was a dental hygienist and I taught at Indiana School of Dentistry. And I had two kids, and one of them had the issues. He was born a breech. We took his tonsils out at 3. He couldn't breathe. He couldn't sleep. He didn't like to eat anything unless it was soft. He
Wow.
couldn't chew. He had headaches. He had TMJ problems. And
Wow.
at the time, we lived in Chicago, a suburb of Chicago, and I took him to every doctor. Even I took him up to Mayo Clinic.
Wow. How
And
scary that must have been for you.
yeah, he wasn't sleeping. His headaches were so bad. I would get a call from the school nurse saying, he has another skull crusher. Come and get him.
My
And
goodness.
I tried everything, and then we got transferred. My husband got transferred to San Diego, and I started working in a holistic dental office.
Great.
And my eyes were open because at the Mayo Clinic, they wanted me to take him to a neurologist who wanted to do exploratory brain surgery on
Oh
him
my
because
God.
his headaches were every day, and he couldn't
Yeah.
focus. He couldn't go to school. So when we moved to San Diego, this dentist, I told him I might need some time off because my son may need some surgery on his brain. And he said, "What?" He said, "Let me take a look at him." And I
Wow.
said, "Okay." And he said, his tongue is in the wrong place. I said, "I never heard of such a thing. I mean, I taught in a dental school. Nobody taught me about where your tongue should be." He said, "Yeah, it's supposed to be up in the roof." And his is down. He said, "I just took a class in myofunctional therapy. I want you to do these exercises, and I'll have you see a osteopath that does the cranial work." There was only 2 in the country at the time. This was a long time ago.
Wow. Yeah. We have a lot more osteopaths today. Thank God.
Yeah. And so I took him. Her name was Viola Fryman, and she was in San Diego. And we started doing the exercises, and he made a little bite split for his mouth. Within 3 weeks, his headache stopped.
That's amazing.
And then he started eating. He would eat like 2 meals at a time. He was real small. He was failure to thrive kind of thing. And he started eating like there was no tomorrow.
Amazing. What a
He's
great
6 foot
story.
tall now. But it inspired me seeing him, his headache's gone, his jaw pain stopped, his he could focus, he could go to school.
Yeah.
I was like, I have to learn this. And that was a long time ago. He's
Yeah.
all grown up now. He's very handsome. Somewhere here,
Nice.
a picture of him. He was
There's no coincidences in life. You were meant to be in that office so you can learn this technique.
he actually
Oh,
went on
very handsome.
he went on
Yes.
to be a model and an actor, and that's why I moved to LA to be closer to him.
Oh,
And
very
he's
nice. It
doing
must be
great.
so fun.
Yeah, he's doing great. Very happy. And
That's
inspired
amazing.
me to study everything in the field. And I've written a lot of stuff. I actually did grand rounds at Mayo Clinic in Rochester, but I've now written a book that you'll see out in the next few weeks. So,
Yes, I'm excited about it. The name of the book Is Your Tongue Killing You?
yes.
And what kind of things are you going to teach us in this book?
I'm just chewing, breathing, swallowing. I have 10 co-authors that wrote chapters in the book. Like there's an orthodontist and a periodontist and just all kinds of different a sleep medicine specialist. These are mostly my patients that write
Okay.
their story in it. So it's kind of cool, but I'm
Yes.
excited about it because this book was written for the layman. It's not an
Very good.
academic, thing but we have a lot of citations, but it is written for the public. So I'm really
Yeah. I want to go back to sleep because so many people are not sleeping properly today. And we have, diagnosis of sleep apnea, of course, and it could be mild, moderate, or severe. How do you work with patients with sleep problems? And can you help all these categories?
Yeah, I would say mild to moderate, definitely. If there's severe sleep apnea, I can help them be more comfortable with the CPAP, or I can reduce it down to moderate. Yeah, it works because we're dealing with the cause of sleep issues. The cause is generally if they're not breathing right and not swallowing right, this whole mechanism here is not working right. Now, if they have central sleep apnea, that's we can't really do much for that. That's more of a brain thing, and they have to wear their CPAP. Or sometimes MMA surgery, maxillomandibular advancement surgery helps.
Okay.
But it's
So,
not,
do you, when you have somebody with mild sleep apnea, can you completely get rid of it?
yes.
That's pretty incredible. Yeah, just by retraining. And how long does it take to kind of
Well,
work?
it's there's an intensive part that I would need to see the patient pretty much weekly for about 3 months. And then it would be that's the intensive, and then there'd be follow-up to make sure it's going to last the rest of their life, because we have to develop a new neuroplastic pattern from the brain to all these muscles so it becomes a habit. We start
Okay.
with working on isolating and activating all the 16 muscles inside your tongue. And then we go into chewing and swallowing and breathing using your diaphragm and the back of your
Mm,
tongue to bring more oxygen in. Then
nice.
we work on swallowing in your sleep correctly and posture. Posture is a big part of this because if you think of it logically, your head weighs as much as a bowling ball and your tongue weighs 3 ounces. So if your tongue is resting down and
Yeah.
forward, it's just enough to cause the first three vertebrae to come forward. And that puts a strain on your back. Yeah.
Okay. So posture is part of your basically
Right.
therapy
I
for patients.
studied I studied with Mariano Roccabata, he's a physical therapist and an orthodontist in Chile, in Santiago. And he's written a lot of books. And he said that you can't really change the posture until you change the position of the tongue.
Interesting. I had no idea there was a correlation between the tongue position and your posture.
Mhm.
Oh,
Yeah, because you're
fascinating.
dealing with the cause of the problem. Your tongue is actually connected all the way to your feet with fascial tissue. And that's another thing. If that fascial tissue is restricted, we call it a tongue tie, or if your lips are connected wrong, then sometimes we need to enlist somebody like you to help release that. Yeah.
Yes, yes, absolutely. And I know you and I have had mutual patients together and to release the tongue. And how often do you see tongue ties?
Well, it used to be very rare when I first started. I would maybe see one or two a year. But now I would say at least half of my patients are either lip or tongue tied or both. And they
That is
don't
a
know
big
why.
change.
They think, I work with a pediatric cardiologist who's seeing almost all of the babies born with tongue ties. And he feels it's plastic, that we are plasticizing our body. And also the air quality, the blue green algae in the air. It's our environment. Something
Yeah.
has changed. Our skulls are getting smaller much faster than we ever hypothesized. And that's probably from not chewing. But and our brains are getting bigger with all the information. So everything is changing and morphing. And the fascial tissue gets stuck. It's like it doesn't want to
Yes.
move. Stretching sometimes will allow us to get a very easy release. That's why we do myofunctional therapy first for a while before we actually do the release, and then after. Otherwise, it reattaches. So it's kind of
Mhm.
tricky.
I see. So let's say after a tongue tie surgery. So basically, the way we trim this, depending on the tongue tie, is we try to keep it minimal with a laser. Sometimes we have to go deeper, and then you work with an ENT for that. But how soon after surgery do you have patients start therapy with their tongue?
Um, Usually I'll see them for 5 or 6 weeks before,
Okay.
and then completely after. I have to see them right away to make sure it doesn't reattach.
Yes, and those fibers that are underneath the tongue can be pretty aggressive, and they actually attach pretty fast.
Yeah.
So people have to work through the pain
Mhm.
of utilizing the muscle and extending
Yeah. It's just exercise like anything else. If you don't use it, you lose it.
that.
So
That is so true.
what we
Yeah.
do is we get the tongue so stretched that when the doctor finds the cord and releases it, the body knows how to react to that. So doing the therapy before is essential, because
Yeah.
if you don't do it, if you just cut it, it reattaches, and then you've got scar tissue and a tongue tie again.
Yeah, that's a problem there. Scar tissue is definitely a problem. Um, so we covered so many different topics, but I want to talk about orthodontics, because a lot of people just basically, oh, my kid's teeth are crowded. Let me just send up to the orthodontist. They're going to put on some braces, force the teeth in one position, and then sure enough, things relapse. So how can you help with this relapse, or can you help with the relapse in orthodontics?
Oh yeah, definitely. If it was just done and you took the braces off, yeah, we can adapt the muscles to the new structure. And so we can
Hmm.
help that orthodontist get stability. I know they put in retainers a lot of times, but people then don't wear the retainers. Or what are you retaining? You're fighting. Your muscles are fighting your teeth. So after a
Exactly.
while, even after a couple of years, they say, "Oh, you don't need your retainers anymore," but they're still tongue thrusting again, swallowing 2,000 times a day or whatever, with all this pressure. Or their tongue is not resting. It's not just the swallow, it's the rest position of the tongue. The tongue should be resting up in the roof of the mouth. And I know
Mhm.
you've all felt these like ridges on the roof of your mouth. They're called rugae. Those are nature's suction cups to hold your tongue up. Nobody knew that.
Yeah, that's a good tip.
Yeah.
Yeah,
So that's where your tongue should rest. If you say N, that's where the tip of your tongue is supposed to rest.
yeah. And it's not like that for so many people. So with this tongue thrusting and swallowing, then the front teeth usually flare out, and then you end up with spaces. Exactly.
Mhm.
Um, now, in terms of starting therapy ahead of the orthodontic treatment, would you recommend that, or would you prefer it after the orthodontic treatment?
I It just depends on each case. Like I tell my students, everybody's like a snowflake, different. The ideal is if the child is thumb sucking or nail biting or has a habit, what will come in and eliminate the habit. We do behavior modification and then send them, if their palate is real narrow, we'll send them back and they'll do some expansion. And then after the expander comes out, they'll send it back to us. And then we'll do the therapy to get the tongue up and get them breathing and getting their lips closed. And
Mm.
then we send them back to the orthodontist to maybe for some Invisalign or something to gently finish the case. And then they'll send them back to us. So we work back and forth to make sure that the tongue is adapted to the new structure. So that's the way it should be. I think every orthodontist should definitely have a myofunctional therapist in their office. Mhm.
I agree because it's only going to improve the results and like the long-term success of the
Right,
treatment.
right.
So, I know some people listening to this podcast are not in California. They cannot send patients to you. So, how do they find a myofunctional therapist?
Well, most myofunctional therapists today are working with telepractice. So,
Great.
yeah, and there's two different organizations that have listings for therapists. One is the AOMT. If you go to aomtinfo.org, and then it'll say find a therapist. There's a directory. And the other one is the IAOM, the International Association of Oral Myology. And
Mhm.
then you could try to find somebody in your area that way. Yeah, you want to find somebody certified. Most myofunctional therapists are either speech pathologists, a dental hygienist, or dentists, or occupational therapists, or physical therapists. Those four, or sleep techs now too.
Interesting. How does somebody learn if somebody wants to train to be a myofunctional therapist? How do they go
Well,
about that?
most of the people, it's a postgraduate course. And my goal before I die is to find a way to get it into like a master's program of its own or a doctorate program. The doctorate program would be great because we have specialists for lungs or for heart or for orthopedics, or we have so many specialists in medicine and dentistry. We need to have a tongue doctor, a specialist that specializes in the treatment specifically of the tongue. And ear, nose, and throat doctors, they don't really address the tongue function. They
Absolutely.
can look at oral cancer or something like that, but they don't look at the whole function of swallowing and chewing and breathing. And speech therapists, a lot of times, they don't look at teeth. And physical therapists are taught to stay out of the mouth. It's not your scope of practice. And the occupational therapists, they learn the cranial nerves, but they don't learn about the muscles and the functions of the tongue. So right now it's a postgraduate course. I know I teach with the AOMT, the Academy of Orofacial Myofunctional Therapy. And it's like a 58-hour postgraduate course of training. And you
Right.
have to do like 2 case studies as part of it, of your certification, and pass a test. So
Right.
that's
And all those hygienists who are listening, to this podcast, I think it's a great thing to learn as a hygienist to recognize issues and maybe even motivate the dentist to create a myofunctional therapy program in their practice.
Mhm. The American Dental Association today is having a meeting with for children's airway, and big part of it is myofunctional therapy.
So that's exciting, Joy. We're making progress.
Yeah, we
Sounds
are.
really
We
good.
are.
So I hope to see it in a doctorate program for sure.
Yeah.
Such great information you gave us today. Thank you for your time. And before we leave, I want to see if you have one quick tip. It could be about anything, for mothers or for patients in general. What can they do at home about anything?
Okay, so I would say the goals. I laid out 6 goals of myofunctional therapy. One would be breathe through your nose all the time. Taping your lips help when you sleep, but during the day, you can't walk around taped all day.
No, it's not a good look.
You got to eat and talk. So breathe through your nose. Rest your tongue up to the roof of your mouth, to the end spot, but not just the tip. Your whole tongue should be up. The third one would be sleep on your back, because people who sleep on their sides, they develop a long, narrow face, and they also develop posture problems. He sleeps on his back, he sleeps on his sides or his
I,
stomach, and you can really see the difference.
I
Now,
see.
it's really hard to sleep on your back if you're tongue tied. You'll choke on your tongue The only way you can sleep on your back is by elevating your bed the size of a brick. You're at a slight slant, so your tongue, instead of choking you, will drop forward. Okay?
Okay.
So if you can, try to sleep on your back. You could take your big pillow and hold it on top of you, because people sometimes need that feeling of support.
I'm going to have to try that because I'm a side sleeper, but now I'm going to focus on my back sleep.
Yes.
Okay.
So
that was 3. We got 3 more.
Also, rest your tongue up. Did I say that? Lips sealed. You should try to get your lips closed as much as you can, comfortably, except when you smile or talk or eat. But and you have gorgeous teeth. I'm looking. So lips closed, tongue up, breathe through your nose, sleep on your back. Oh, keep your hands away from your face. That's very important. People don't realize they're always touching their face. And a lot of times they do that because they're missing the endorphins.
Interesting.
If your tongue is up, you're getting endorphins. There's a place on the roof of that's why kids suck their thumb, because their tongue is not up there. So they get endorphins. So your incisal papilla has a lot of nerves and arteries. So when you stimulate that, you feel good. So if your tongue is down, you're always like trying to touch your face, because when a baby is born, they look to find the nipple. And so your facial nerve is extremely sensitive, and you get endorphins when you touch your face.
Oh, fascinating. Okay. These are amazing, great tips for everyone at home.
6, breathe your nose, tongue up, sleep on your back, hands away. Oh, and the last one is very important. You're going to bite when you swallow only. So a lot of people clench their teeth because they went to a dentist and they put that blue paper and they said, tap, tap, tap. So they think that they're supposed to clench. And if their jaw hurts, they have TMJ pain and they're sleeping on their side, the disc slips. So they clench to try to get their jaw in the right place. But if your tongue is up, it's going to stabilize. You don't have to clench. So anybody with TMJ problems, we do this jaw stability exercises first to try to get these symmetrical. We teach them to chew on both sides. I use these little surgical tubing to develop facial symmetry of the muscles. And then I'll have them use this little wafer that you slide to work the lateral pterygoid muscle. I learned that at UCLA. Here it is. You can buy these from any orthodontic program.
And let's chew on that.
No, you just put it in between the teeth.
Okay. And just rest.
Slide your lower jaw forward and back.
Okay.
That helps.
That develops your muscles.
Yeah, it helps to reposition the disc.
So actually, this reminds me of a story. My neighbor at one time, she's like, I bought this rubber block from Amazon and I'm going to chew on it to develop muscles for beauty. So she was chewing on one side. Do you recommend, obviously, both sides at the same time, correct?
Yeah.
Very, very important. Yeah. So this kind of brings me to another point. If you're exercising the facial muscles, we're going to look more lifted. We're going to age well. So myofunctional therapy is an anti-aging therapy.
Absolutely. I know in Brazil, there are myofunctional therapists that exclusively work with plastic surgeons to either prevent a lot of surgery or minimize it. And it's really powerful because your muscles are attached to the skin. So if you want a beauty technique is to get all the muscles working strong and tight.
Now I understand why you never age, Joy. I get it.
Oh yeah, if you ever come to a convention I know you'll see myofunctional therapists, they're 90 and they look like they're 50 or 40. It's like unbelievable.
I'm definitely coming.
Yeah, definitely.
So for everyone, we're going to post a link on the bottom where to find Joy's new book, Is Your Tongue Killing You? That's going to be on Amazon. And Joy, where can people find you?
I'm in Pacific Palisades, Joy Mueller, Moeller. And you can contact my office, 310-454-9444. And I could either find somebody in your local area if you want to see somebody in person, or if you want to do online, I can give you some names for that. Of course, if I'm still practicing, I'll do it as well. So thank you.
Thank you so much, Joy. Have an amazing day.
Thanks for the opportunity to educate.
My pleasure. My pleasure. It's been super informative. I've learned a lot.
Good. Okay. Thank you.
Bye.
Bye-bye.
Thank you so much for joining me this week. Please make sure you check out the show notes for any links mentioned in the show. If you like today's show, please invite your friends to listen as well. That would mean a lot to me. Do you have a question you'd like me to answer? Message me on Instagram at Dr. Sanda. This is Dr. Sanda, and remember, your mouth is the gateway to your health, so take care of it in the most natural and best way possible.